In this video we're going to cover how to do an end to side anastomosis if the blood vessel that you're anastomosing here, the one on the side, is fixed to a limb and it's unmovable, which is a bit of a different technique if this part of the blood vessel is movable. Okay, so there's a variety of different also techniques of how to connect these two blood vessels. In this video I'm going to show you one way in which you're able to connect these two in a continuous fashion using a single needle, a single arm suture. I do want to point out that I'm not using the correct needle in this video just for demonstration purposes, but in real life you will be using something like a tapered needle that doesn't have a cutting edge to it. In this case, a reverse cutting, so we know that the cutting edge is going to be at the bottom side, like this triangle. Alright, so here are the tools that are going to be needed for this example. We're going to use the Bakeys, some needle drivers, some scissors, and this thing to basically hold on to our suture. In real life it has some rubber ends to protect the needle, but I don't have that in this case. Here you can use some Castros, or you can use some regular needle drivers. This is probably going to give you better control and better finer movement, so it just depends on your preference. Alright, so with these blood vessels, it really doesn't matter what angle it comes in, because essentially the steeper the angle, the more of a cut you're going to have to make on this blood vessel, and that's fine. You're just going to create a bigger opening, right? This case is somewhat vertical, so I'm just going to create something like this, and I want this point to be somewhere in the middle of the blood vessel, and I'm going to call this my apex. Okay, so let me get a marking pen and get started on this. So my incision is as wide as the horizontal I'm able to draw here, so my apex is going to be right here, right? So that's where I'm going to start making the incision. Also, I did want to point out, whenever you're cutting the blood vessel on the recipient end, which is this one, you do want to make it slightly bigger. So maybe I'm going to start cutting right there, right? And then I'm going to draw a horizontal line, right? So essentially somewhere around here, because I want that to be nice and straight. So apex there, vertical somewhere around there. So I'm going to cut, or making a line right there. Okay, and then I'm going to go ahead and follow that so I know what I'm cutting. Ideally you want something like an 11 blade, maybe something kind of that you're able to stab into. This is a 22 blade. It's used for skin, but you know, I'm going to try it anyway. You just want to make an incision there just on the top side, and then go ahead and grab some scissors and extend the incision all the way down. So let's go ahead and bring our recipient end, and now we need to trim it to the size. So based on our planning, we need to cut this blood vessel at an angle and make sure that it lands right there. So I'm going to use this curved Mayo scissors. And I'm going to angle my curvature upward like this whenever I'm making this cut. I'm going to grab some of the Bakeys for counter traction. I want to make sure it's nice and straight, so I'm going to go ahead and retry here. Alright, so the first incision is going to be on the recipient end, and I'm going to go ahead and cut, or make my first throw here at the apex, right at the beginning. Okay, the next throw, I'm going to do this one backhanded, but essentially we want to come out the apex on the donor side, so I'm gonna call this one the donor side from now on. So the apex will be somewhere around there, like well, you know, I really want to make sure that this thing doesn't fall apart, so I'm just gonna, there you go. At this point, go ahead and protect your needle, make sure nobody gets stabbed as best as you can. And I'm gonna run it through, and I'm gonna go ahead and grab my tail here as before, and I'm gonna go ahead and clamp this one, and I'm gonna secure it somewhere so I have some counter traction as I'm beginning to make So I'm going to use these rubber bands here to help me out with that. Alright, so there you go. We've made our first throw. From now on, essentially I just want to run my stitch on this plane below, and I'm going to use the fact that it's fixed to my advantage, because at this point I'm able to kind of sandwich them together and just kind of run it like that. So that's what makes it a little bit easier in this case. So just kind of run it like that, move it around, make sure the tip is away from the needle end. Good. So I'm gonna be behind my suture line, so I'm not gonna sew here, I'm gonna come behind here, okay, and I'm gonna run right there. At this point I think I'm gonna do a front hand throw on this next one, but I'm gonna move my suture around. I want to see where I'm coming out of the apex, and I want to make my throw basically mirror image on the other side. So I'm gonna run that through and see what happens. So I have this counter traction. If you have someone helping you out, it's gonna help tremendously with this technique. So as you can see, I'm kind of on this wall, the side of the wall, so it means that the next throw has to be right there, and then I can start running it like normal. So I'm just gonna do my first throw right there, or not my first throw, but okay. From now on, run all the suture through, and I created this nice layered thing that I have here in order to suture. So all I have to do is make one throw or one pass with the needle if possible, and just pull it through after every throw. So let me see if I can line these up correctly. So maybe something like that. We're using your both ends of your needle drivers to pull some sort of traction there, and then I can slide my needle behind here and pass on both ends like that. So pull it through. You can use this technique. You're using your other finger to not bring the needle driver to the sky, especially to maintain sterility and that sort of thing. Okay, my two ends are probably lined up there. Alright, so I'm just gonna follow this technique all the way down, and then I'll meet you at the apex, okay? I know I said that it might be easier to do one of these, but I find it much easier to do one end at a time. So I pass here, and then I'm going to present this donor side to my needle, or where I want it to come out of, and then come out right there. But same pattern applies. Just running it all the way through. Alright, so here we're pretty much here at the apex. So what we're gonna do now is figure out what side of the blood vessel we're on. In this case, we're on the inside of the donor, which means we need to go on the inside of the recipient, which is this one. So I can probably do this in a front hand throw, but I want to come out right at the apex. Then this next one, I'm gonna do a backhanded because I want to come out backside here at the donor side. So gonna switch out the angle a little bit. I'm gonna move it up, and I'm gonna come out right there. Alright. Alright, so now that we kind of see where we are, we're going to be on the inside of the donor, I'm pretty sure. Yep. Inside donor, which means we got to go on the inside of the blood vessel on the recipient end, which is going to be right here. Now this one's going to be a little bit tricky just because we have a lot of overlap here, and this material is pretty elastic and it's not forgiving. So essentially the idea is that we're going to do a backhanded run all the way down to the apex. So once we're over there, I'm going to show you a couple throws here and then go from there. So I was trying to figure out the best way to atraumatically move the vessel out of the way so you can safely pierce only the side, the lumen, but not the other side. So once I do that, I can probably do something like this, present myself on the other side. And just continue, right? Same pattern. Let's see, I got it right there. I'm running it here at an angle, so that technique is something that has helped me quite a bit. But essentially, you want to come out right across from the side that you came out on, and then once you came past the needle through this side, you want to run it at an angle and just continue that pattern throughout. Alright, so my needle actually came off. I think I don't know if you can see that, but I think it probably pulled too hard. So at this point, mistakes happen, you know, it's normal. I'm gonna go ahead and tie this off, and then I'm gonna just run it all the way through. So there are quite a few throws here. I'm gonna present this upwards. I'm gonna cut right there. Yeah, just follow the pattern. Same thing. So at this point, I'm pretty happy with where I'm at in terms of the needle, so I'm just gonna go ahead and do that, let that go. We're on the opposite side as this tail end, so I'm just gonna go ahead and suture that. Okay. Go ahead and leave a little bit of a tail there, something around there. And here's our finished product. So I know this is supposed to be unmovable, but I'm just going to go ahead and move it anyway, just to kind of see how it came out, right? So yeah, the point of the anastomosis is to create like a watertight seal. It does look a little bit different on this side than this side, but that's just because of the angle that we're stitching. Overall, I'm very happy with this result. As you can see, it's nice and patent. I can even cut this and see the inside. And go ahead and cut it right there. Yep. So we achieved the objective of creating a connection between a blood vessel on the other side, and that's how you do it. One way to do it, if this side is unmovable or fixed. Thank you for watching. I really hope this was helpful.